So, dear friends, my name is Dr. Igor. I'm clinical oncologist practicing since 2010. And today we are talking about osteoporosis. It's a serious and very common condition which affects a lot of people, especially postmenopausal women, because they lose their sex hormone levels, and sex hormones, the estrogens, they protect the bones. And after menopause, when the sex hormonal levels drop dramatically, then the rate of osteoporosis development will be much higher. Osteoporosis is connected to loss of bone production and increase of bone resorption and decreased mineralization. Bone production is a function of osteoblasts. Bone resorption is production of osteoclasts. Is a function of osteoclasts. Osteoblasts produce bone, osteoclasts resorb bone. Of course, if the bone becomes less dense, it becomes fragile and it can be easily fractured. And fractures are very dangerous, especially when the person is old. That's why during osteoporosis we are trying to increase osteoblast function, so they will produce more bones, and decrease osteoclast function, so they won't eat the bone so much. All our drugs are divided into two large groups. First will affect bone resorption, and we will talk about them later. The other will affect mostly bone production. They are anabolic drugs. I want to remind you about risk factors for osteoporosis. First group is non-modifiable, that we can't influence. For example, gender, age, genetics. The others are modifiable, that we know them and we must influence them as much as we can. For example, alcohol intake, smoking, low physical activity. If we tense our bones, it will increase the signals for our body, so the bone is needed and the organism will make this bone, will pay more attention to this bone, and it will send the signal to osteoblasts, so they will produce more bones, more mineralization will occur, the hormonal changes will happen, and it will suppress osteoclasts, so it will tell, don't resorb bone so much. By the way, bone is a very alive organ, and the processes of bone production, bone resorption occur all the time. And this must be equilibrium, but during osteoporosis, the equilibrium is disturbed and osteoblasts are not very active, osteoclasts are very active. That's why we get this problem. And when we try to treat osteoporosis, we try to aim osteoblasts so they will be more active, produce more bone, and these are called anabolic agents. And the other group are aimed onto osteoclasts, so they won't resorb bone so much. And these are antiresorptive agents. So let's talk about these drugs. And in the next video, I will tell you about the natural remedies that can help in struggle with osteoporosis. Let's get started. So, dear friends, let's start from the antiresorptive that work on the osteoclasts, that don't let the bone degrade. And the first group of drugs is bisphosphonates. Alendronate, risedronate, they are most commonly prescribed. These are tablets, they are taken orally. Also, there is other drug, zoledronate, that is intravenous. It's more potent and it's given once in half a year. They really can improve their mineralization and bone density, but they can't restore the normal bone function structure if it's already lost. That's why they work until some point. Afterwards, after long-term use, after several years use, they lose their effect in decreasing the risk of fractures. Among their side effects are nausea, vomiting, constipation, peptic ulcer, allergical reaction, osteomalacia, and sometimes rarely the necrosis of the jaw. The other group of drugs are estrogen or female sex hormones. We know that after menopause, the sex hormone levels they drop and the woman starts to develop osteoporosis very fast. That means that estrogens, they protect against osteoporosis. And we can give the hormonal replacement therapy, the estrogens, to these women. They're really effective, but they're not very good for long-term use because they can increase the risk of breast cancer, endometrial cancer. Also, they can increase risk of thrombosis. And that's why we have the other drug, which is called raloxifene, or selective estrogen receptor modulator. This is the drug that can work in different ways on the estrogen receptors, sex hormone receptors, depending on the organ. That's why it has similar effects on osteoporosis like estrogens, but it doesn't have the effect on breast cancer. Actually, the effect is opposite. It will decrease the risk of breast cancer because there it will block the receptors of estrogens. Unfortunately, it can cause strokes or leg cramps. It can cause thrombosis and some hot flashes. The next drug is calcitonin, which is the normal hormone of the human. It's given usually when the person has contraindications or intolerance to hormonal therapy. It suppresses osteoclasts and can be actually used during the acute fracture in osteoporosis people. But it can cause some nausea, vomiting, allergic reactions, flushing, nasal problems, and in males can cause even increased risk of prostate cancer. Next drug is denosumab, which is antibodies that will work in similar fashion as the previous drugs. It will decrease the activity of osteoclasts, meaning the bone will be resorbed less. It is injected once in half a year. Unfortunately, it can increase cholesterol. It can cause cystitis or inflammation of the bladder, and it can cause some muscle pain or dermatitis, and also it can cause necrosis of the jaw, like bisphosphonates. Strontium ranelate. This is another alternative to bisphosphonates. It's well tolerated. It has some mild gastrointestinal side effects, and it can increase the risk of thrombosis. And by the way, some data tells us that maybe it has also some anabolic effect, meaning it will increase the production of the bone. Also, of course, we always recommend vitamin D. Vitamin D is, first of all, it's checked, and then it's given in different doses depending on your level, and it's usually given with vitamin K2 or MK7. That is also important for bones, and it's important for calcium to go to bones, not to the blood vessels. And also, it's always recommended to give calcium supplements, although lately it's questioned because calcium supplements don't really decrease the risk of fractures, but increase the risk of some side effects and complications like gastrointestinal side effects or kidney stones. And now let's talk about anabolic drugs that will increase the production of the new bone. And first of all, this is teriparatide. This is analog of our PTH or parathyroid hormone, and it will improve the bone formation. Unfortunately, it can cause headache, nausea, vomiting, allergic reactions, pain in the muscles, and increase in calcium level in the blood. Also, some rat studies show that it may increase the risk of osteosarcoma, tumor of the bone, but it's not clear if it's real in humans or not. Romosozumab is the monoclonal antibodies against sclerosing, meaning it works on the signaling for bone formation. It really decreases the risk of fractures in osteoporosis. Unfortunately, it also has some side effects like pain in joints, pain in lower back, nasopharyngeal problems, allergies, and necrosis of the jaw like bisphosphonates or denosumab. And we have some concern that it may actually cause increased risk of some tumors, but we are not sure yet. Dear friends, of course, it would be smart if we work on both stages of osteoporosis, on bone formation and bone destruction. That means the combination therapy may be necessary in many cases. We combine the drug acting on the osteoblasts and with the drug acting on osteoclasts. And by the way, in many clinical trials, these combinations showed that adverse reactions did not actually arise very much when the drugs were combined. Once again, you understand that osteoporosis may be very serious. It can cause fractures, it can cause disability, and it can cause eventually death. That's why it's very important to deal with it and to take it seriously. Knowing this information, you can always inquire your doctor about the treatment, about pros and cons of the drugs you're taking, and maybe ask the advice about changing the drugs that you don't tolerate very well, for example. Don't forget that the first steps are always to start from the changing of your lifestyle, of your food, of activity. You must always tense your bones so they get signals that the bones are needed for your activity, and your organism will increase the new bone formation. That's why activity is very important. And in the next video, we'll talk about the medicinal plants and natural compounds that can be valuable in their struggle with osteoporosis. My name is Dr. Igor. Bye-bye.